In times of war, we build military bases in order for us to fight well. In health, especially when we declare NCD crisis, we need health facilities as this comprehensive health center to manage NCD's complications to save our lives and the lives of our generations to come. Honorable Prime Minister, Honorable Jeremiah Manale, Honorable Deputy Prime Minister, Honorable Bradley Tovosia, Your Excellency, Ambassador Tsai Wei-ming, the new Ambassador of the People's Republic of China to Solomon Islands, and your good officials of the Chinese Embassy, Honorable Ministers of the Crown, and members of Parliament, opposition leaders. I know that there are some chairman of the Parliamentary Committee, the opposition members, and our very powerful speakers as well here. Members of the Diplomatic Corps, representatives of SICA and SIGFA, Permanent Secretary of Health, the Executive Officer, Medical Superintendent, and all staff of the Ministry of Health, and our very own National Referral Hospital. The traditional owners of the land upon which we stand, senior government officials. And today I wish to recognize the former Minister of Health, Dr. Kalwig, and the powerful former Prime Minister and now the Minister of Finance, Honorable Manasseh Sogavare. Members of the media, invited guests, and our patients who are admitted at our National Referral Hospital and elsewhere in Solomon Islands that will be the beneficiary of these health facilities. The private sector, ladies and gentlemen, and those who are turning in and around the country and from abroad. First, let me start by thanking God for giving us good health and enabling us to be here to participate in this very important event for the official handover and the launch of the new comprehensive medical center, the first in the country and perhaps the first for the region. I would like to join my permanent secretary to express my sincere acknowledgement for all your presence and participation this morning. And in particular, I'm indeed honored to have the presence of our Honorable Prime Minister, Honorable Jeremiah Manale. Thank you for joining us with your Honorable Deputy Prime Minister, Honorable Bradley Tovosia. To all our distinguished and invited guests gathered here this morning, I convey my sincerest gratitude for your presence, for joining me at this historic event. Ladies and gentlemen, today is indeed a very proud and happy day for the people and the government of Solomon Islands, as today we are receiving a magnificent gift, a gift that one day it will save your life and my life. 4 years ago in 2020, under the leadership of my permanent secretary and together with her dynamic senior executive management team, had a vision for a new state-of-the-art health facility. A vision to build a facility that would offer highly specialized tertiary clinical care services, that is, disability user-friendly, and that would have a high level of infection control and prevention adaptability. A vision that would offer such highly specialized clinical services that could be assessed promptly in country without having to travel abroad, thereby saving the government millions of dollars. A vision that a health facility would be a state-of-the-art facility that would promote the best, the cleanest, and the safe workplace for the specialist doctors, specialist nurses, affiliate health staff, and other supporting workers. Ladies and gentlemen, the new Comprehensive Health Center, or for short CMC, was that vision which has now been all fulfilled today. And I'm very happy, and in Chinese I would say, 我很高兴. These three visions are central to the broader National Health Strategy 2022 to 2031 visionary pathway for all stakeholders and the NRHs as a critical service provider, and in our efforts towards the achieving universal health coverage for the people of Solomon Islands, ensuring the best quality health services are accessible by our people. This is a flagship project between the government of Solomon Islands and the People's Republic of China, costing SBD $90 million. This new comprehensive medical center would bring about change by upgrading the level of care, services in country for our people who would need them when this facility becomes operational, as this facility will be offering specialized medical services for our people now and for our generations for the next decade. Ladies and gentlemen, Solomon Islands is experiencing a silent killer disease, and that is a non-communicable disease with 7 of every 10 patients at the medical ward of our National Referral Hospital suffering from some form of NCD-related condition, including diabetes, stroke, heart, and kidney-related diseases. The number one of admissions of diabetic cases made up of the majority of the NCDs by around 60%, and the hypertension 40% of the total since 2018. The number of people with essential hypertension cases which have no identified causes but are primary or idiopathic is increasing as well. We saw the total diabetic cases admitted increase, of which the majority were type 2 non-insulin diabetic cases are higher than the insulin dependent, and these are all lifestyle related. The health statistics showed evidence of the seriousness of heart diseases among our communities and our people. The number of admissions reflect an increased trend in cardiac or heart diseases between 2018 and 2020. There was an increase of 11% from 525 to 583 in 2020 recorded heart diseases at National Referral Hospital, affecting more of our men than women. The increasing NCDs recorded are directly related to the higher proportion of our population practicing unhealthy habits, as reported by the STEP survey of the 2015 and 2023, and the fact that National Referral Hospital is seeing increasing related complications to NCDs. The clinical challenge today is the proper management of the diagnosed NCD cases. I am indeed grateful that the new comprehensive health center has come to the right time, but long overdue, a facility to assist our doctors be able and treat NCD complications, particularly that of the kidney and heart. And ladies and gentlemen, while the new comprehensive medical center will now cater for the specialized services for those that have NCD complications, my ministry is more determined than ever to tackle the silent killer of the NCD to ensure a vision towards universal health coverage for the people of Solomon Islands. The government's priority of my ministry is to tackle the NCD crisis in the country head on, positioning our reach to communities and families, thus stepping up on strategies and interventions on primary health and community population health. But health can cannot do this alone. It is all of us together to fight against non-communicable diseases. It's all sectors, both the public and the private sector, communities and families. We are all together in this fight against NCD. Ladies and gentlemen, as the Minister of Health for Solomon Islands and being a clinician myself, I'm a very, very happy man. And I'm extremely proud of this auspicious moment, of what we have accomplished together, and of what we have embarked on for the last 13 months of construction. To witness this moment and this achievement is remarkable and truly humbling for me. But this day would not have come to fruition if not for the hard work, endless hours, and true dedication of my hardworking team and officials of the Ministry of Health and the National Referral Hospital, the officials of the Chinese Embassy, the Central South Architectural Design Institute, the Jiangsu Construction Group, and all our stakeholders, including our line Ministry of Finance and Treasury, Police, Environment, and Honiara City Council and state-owned enterprises, all the SOEs, the Solomon Islands, the SIEA, and the SUA. We have journeyed together on this, and we now stand proud that we have done it. I must thank my predecessor, Dr. Togomana, for starting this journey, and we are here now to complete that journey and begin another journey of saving lives. I cannot thank all the key players and all the support team enough. We have worked tirelessly in putting all the resources, the efforts, the time, and the energy together in finally making it happen today. The onus is now upon us to be responsible, and before we are meeting the Prime Minister, the Ambassador of China to Solomon Islands whispered to me, today you are looking after this facility. My good friend, I am hopeful that I will look after this facility in taking care of this national asset. With this guest of honor, Honorable Prime Minister, and our good invited guests, colleagues, and ladies and gentlemen, thank you for your attention. And before I resume my seat, I wish you all good health today and beyond. And also, I wish to take this opportunity to wish all the workers of this facility Happy Chinese New Year, and I wish you all safe, healthy journey back home to China. 我要说新年快乐。Again, I would want to conclude by saying, God bless Solomon Islands. God bless People's Republic of China. Thank you.